remove some of the extra tissue and then remove part of the pelvis. That's why you don't see any bones there. So, and so remember, here's the kidney, and then here's, you know, remember this structure right here is the ureter. I've cut it in order to reflect the urinary bladder away so we can see the uterus more fully. Now this structure right here, which you see, and you can actually make it out sort of on the other side over here. It's right here. Okay, that's one of the ovaries, and here's the other ovary on this side. So they look like little kidney beans. Well, maybe it's like a little white bean or a navy bean. I don't know. So little tiny bean there. Okay, and you notice that in the back of this, they're in in the cat, they're in a little pocket. Okay, and this little pocket basically is, you know, this area here is the, you know, that's where the fimbria are, basically for the oviduct, okay, or the fallopian tube that opens out to an ampulla like this. And you'll see that in the human models a little bit more fully. And then basically it captures the ovulating egg as it comes out. So when ovulation occurs, the egg actually momentarily is in the peritoneal cavity. So it doesn't, you know, and so in many mammals like cats, the fimbriae, which are the opening of the ampulla here, the infundibulum, actually pretty much enclose most of the ovaries so that it's like a catcher's mitt. Okay, in humans less so. Okay, and so in humans, because that's less so, the potential for ectopic pregnancies is greater. Okay, and an ectopic pregnancy is when the egg comes out. So here's the ovary here, and you notice if you look, and this is a hard one to see here, but there's a little catcher's mitt, and then there's this little band, and I just put the point or the probe by it. There's a little band of tissue right there. If you look really closely, it's a super tiny coil of a tube that's coiled over and over on itself, and that is the oviduct. Okay, this thing right here that you see is not the oviduct. That's a uterine horn. Okay, and I want to just go to the board for a second because there